may seem like eons ago, but there was a time when COVID talk dominated our days and our shows. It was only a little more than 2 years ago, by the way. And despite the virus dropping off our daily focus and our radar, it's still the focus of scientists and healthcare experts. And those people are raising the red flag when it comes to the latest COVID concern. The COVID virus can be carried by animals. We know that. That's how it started. But now there's a new wrinkle with how it affects and evolves with animals, and how that could be a concern, not just for the upcoming holidays, but maybe for a decade from now. Here's Joe Paris.
Just this afternoon, the department was notified by our Bureau of Laboratories that we have our first positive case of novel coronavirus.
It's been 990 days since the state of Idaho announced its first confirmed case of COVID. 2 calendar years later, socially, most people have moved on from the virus and virus protocols.
Clearly, the activity's out there.
Dr. David Pate is the retired president and CEO of St. Luke's Health and a member of Governor Little's coronavirus working group. He says the COVID data for Idaho and abroad looks a lot different now than it did in the past. And no, it's not because the virus just went away.
There's a lot of home testing being done. And then a lot of people not even testing.
With poor data samples to draw from, it is hard to gauge what the complete spread of COVID looks like across Idaho. Yes, the state is in much better shape than it was in January of this year when Idaho saw dire situations in hospitals, but a better situation does not mean the situation is complete.
This has been unlike the typical kinds of peaks and valleys that we've had previously, where this has just kind of gone up and then kind of come down and just kind of hovered at still a pretty high level of transmission.
New research on the COVID virus and its interactions with non-human animals highlights the fact that since 2020, yes, we've learned a lot about the virus, but there is still an incredible amount to still learn. Scientists have identified dozens of animals in the United States that have been infected with COVID, and at least 2 species that can transmit the virus back to humans with new mutations. Now, those mutations can be dangerous, helping a COVID virus become more contagious or deadly, or simply keeping the virus alive. The list of animals infected with strains of COVID now include rats, specifically rats tested in New York City.
What was shocking is that 16.5% of them had antibodies, meaning they had been infected at some point. 16.5% of millions of rats is a big number.
The new research, published by a group of reputable experts, concludes, quote, "In summary, we found that rats in the NYC sewage system have been exposed to the coronavirus and that the Delta and Omicron variants can infect rats in addition to the Alpha and Beta variants. Our findings highlight the potential risk of secondary zoonotic transmission from rats and the need for further monitoring of the coronavirus in wild rat populations."
The only virus we've ever eradicated was smallpox, and that was because it doesn't get into any animals. I think we have missed many chances to potentially eradicate this virus. I don't think we can really think of that anymore because it's in so much of the animal kingdom as well as in humans.
The Delta variant of COVID, the variant that powered a major Idaho infection wave earlier this year, it's also been found inside immunocompromised people who evidently did not clear the variant. That fact, along with the research into animals, it illustrates a circuit of continuous COVID.
It's less of a concern about animals, more of a concern that we've got some immunocompromised people out there that have Delta still in them. If you remember back, Delta was really bad for filling our ICUs and people dying. And so that's a very bad form of this virus. And if they still have it, and now what has happened, because we've allowed this virus to keep on changing, the main drug we give immunocompromised people to protect them no longer works against a lot of these. Now the worry is that Omicron of some type will infect them. And what we've also seen this year is a lot of recombinations, meaning that you can have this strain, and then a new one that kind of contains features of the old and the other come together, and you now have a new version.
Experts know a lot more about COVID than they did even beginning of this year, but they still have a lot to learn, and they have to still answer major questions like, what could a COVID infection now mean in terms of long-term health impacts decades down the line?
Unfortunately, we will have a great understanding of this virus. It may be 10 years, it may be 20. At some point, we will have a very good understanding. What my fear is, Joe, is because there are other viruses that people dismiss but cause long-term problems. We have at least 8 viruses that are what we call oncogenic, can lead to cancer. And so, for example, human papillomavirus, we know that can cause a number of different cancers, and that's why we came up with a vaccine for it.
So what do the numbers look like in recent weeks? Well, the Idaho Department of Health and Welfare reports that the statewide PCR percent positivity increased last week from a revised 6.6% to 7.6%, so increasing by 1% over the last week. Idaho is also reporting more than 500,000 total cases of COVID-19, including more than 1,400 new ones since the previous Friday, not last Friday, the previous Friday. State of Idaho also has more than 5,200 deaths to date since the beginning of COVID. Brian, I know that it's not something we talk about on a daily basis here, but in the background of all of our lives, the virus continues to do what it does.
Well, you said a continuous circuit of COVID kind of thing. What does this mean, like, as you said, going forward from here? It's going to be with us always? There's no chance of eradicating this?
It's going to be very hard to eradicate this virus, according to doctors like Dr. Pate, because of the fact that the virus can continue to circulate through non-humans. So even if we got it all the way out of humans, all humans on Earth had no more COVID, it's still circulating through mammals. And there are some mammals that can, transmit it back and forth. So how do we, take this on? What do we do going forward? What's the call to action? Dr. Pate says going forward, he thinks that air purification or using like special UV light to kind of clean out the air, especially in places like schools or business offices, that's going to be really popular in the near future because of the fact that, yes, this virus is still around. We have people that are immunocompromised. It's tough.
I mean, I'm laughing because a continuous circuit. We were just talking about these lights and these air purifiers 2 years ago. Like, that was a new thing, and now that's going to be the way we're going next.
So did you see them installed everywhere?
Some places, yes. Not everywhere.
Some places. So there you go.
All right. Thank you, Joe.